Kia ora, my name is Erin and I'm an Associate Charge Nurse here at the Palmerston North Emergency Department. We serve a population of 175,000 people from Otaki in the south out to Horowhenua, Tararua and of course Palmerston North City. Behind me you can see the entrance to the emergency department where you walk in when you arrive, and just over to the right is the ambulance entry. Follow me and I'll take you on a short tour of our emergency department. When you arrive into ED, if you're a patient, please follow through and see our triage nurse. If you are visiting, please speak to one of our receptionists. When you speak with the receptionist, they register your details and you may be told to take a seat in the waiting room. From there, you either can be moved into the main department or come into one of our secondary triage bays to have some more investigations begun. When you arrive at the emergency department, the triage nurse will assign a triage code to you. These are from level 1 to 5. Triage 1 means there is an immediate risk to life and must be treated immediately, such as somebody who is having a cardiac arrest or been in a major car accident. This requires multiple staff to help this patient. A triage 2 needs to be looked at urgently. It may be that you have chest pain and we need to do an ECG to check if you are having an impending heart attack or a stroke. Triage 3 is indicative of potentially there is something serious wrong, but we have a bit more time to look into it. And triage 4 and 5 are more minor and can wait a bit longer, such as limbs, lacerations or long-term standing conditions that you may have. From the waiting room, you'll be moved through to the main department. Follow me. Our emergency department sees 4,000 people per month, so approximately 128 people per day. We have 13 beds in our main department and we are open 24 hours a day, and we are here to treat the most sick and vulnerable in our community. Our ambulances arrive through the doors behind us and they come into our ambulance bays. They are then triaged by the triage nurse and assigned an area in the department. Over here is our trauma bays where our most sick and vulnerable get placed. We have 2 trauma bays with a myriad of equipment to treat our most sick and critically unwell. In the central work area is our main hub for all our staff, doctors, nurses and other specialties in our hospital. A lot goes on in the central work area. People make phone calls, are on computers, discussing cases, ordering x-rays, CTs, ultrasounds. It's a very busy work area, exploring all the options to look after you. And then we go round to our resuscitation bays. Our resuscitation bays have monitoring equipment so we can keep a close eye on all our patients in this area. Around the corner we have our assessment beds. It is a fast-moving environment in the emergency department, so you can be moved quite often in and out of our beds or to other areas to await your treatment options. Further down, we then move to our subacute area, which has beds and chairs which can be used and add to our areas that people can be treated in. Our subacute waiting area is for people who have been seen by a doctor or a nurse but are awaiting further investigations or results. And the final area of our department is our 6-bedded observation area, where people often stay overnight to await further treatment or are waiting further investigations or social work, physio or OT input. Thanks for watching, and remember, the emergency department and St John's Ambulance Service are for serious injury or medical emergencies. Non-urgent patients may have to wait to be seen, so we encourage you to phone your general practice team or Healthline first for advice and visit an after-hours clinic if one is available.